First and personally, I just really wanted to extend a warm welcome to every one of you for being here and being such an important part of the growth of this event.
We're at the TOBI conference here in Las Vegas, and we're learning about regenerative medicine.
Everyone in this room, we're all pioneers. Each and every one of you doing this has a bit of a pioneering spirit. You're going against the grain, you're trying something new, and we're all collectively taking the time to come here and further expand options to patients, and it's challenging.
I highly recommend it, particularly if they're in the regenerative medicine field, because we have a public consciousness around not wanting to do things with drugs or do things non-invasively, and this is the forefront of it. This is where it's happening. This is where you have all the leading edge thinkers from all over the world.
When I created this event 6 years ago, we were in a small hotel in Los Angeles, and to see it swell to approximately 500 attendees from 40 in just 6 years, to me, is really compelling in the growth of this field.
So this is 120 cc's of bone marrow from a single patient, and then is distributed into multiple groups and simultaneously processed.
We utilize IV sedation and then harvest the bone marrow, and from there, under fluoroscopic control with a 2-needle technique, place a needle in the center of the affected nucleus, and at that point would inject 2 to 2.5 cc's of the bone marrow concentrate.
99% of it is in the top 10 microns. So the important thing is really to restore that top superficial area of cartilage in order to absorb shear dissipation.
We were here last year as well, and it was one of the meetings that we absolutely needed to be at again this year.
We have an experimental model from Bennett that shows us how nerve trunks can cause pain.
And one of the things we found was a statistically significant amount of ILRA1 or IRAP.
That's how PRP is working. It's releasing the MSCs from their vascular sites and putting them into play.
The speakers are all around the world, so it gives like an international event.
We have some new data that maybe throwing out the platelets in certain indications will be the best thing. So PRP is going to change.
100%. Come here. I love Steve. I love the conference he put together. There's some brilliant people here.
I've gone to a million of these, and everyone here has been very personable. It kind of takes the edge off so that everyone can kind of focus on problem solving and providing better technology for patients.
We also have over 100 individuals around the world streaming, and they'll be chiming in with questions.
I think this symposium has really grown, and there's a lot of momentum and enthusiasm, and a lot more people are aware of cell therapy, so it's an exciting time.
We have 2 different labs going on. One is learning how to do bone marrow aspirate. The other side of the lab are doing ultrasound guided procedure on all throughout the body, upper extremity, lower extremity, pelvis, and they're getting to talk to some of the experts and leaders in the field.
Hands-on is the way to go. It's the only way to learn. There's just so much out there, so many techniques.
First time here, I'm very impressed with the quality of people here, first and foremost. The quality of the organization. I really am impressed with Dr. Sampson and his staff, and how he has really worked hard to get the leaders of the entire field, whether it comes from imaging, whether it comes from industry, whether it comes from faculty, to get everybody together under one roof. It's really been impressive.
From a 1 to 10, I'd give it a 12. It's fabulous. So I would highly recommend it, and for many different specialties. This is all about cell therapy for a variety of different patient indications, so it's fabulous.